We will be dealing with the remaining part of the developmental defect of the craniofacial structures today. The first defect which we'll be dealing is chondroectodermal dysplasia. It's also called as Ellis von Crevidel disease. This disease was first described by Richard W.B. Ellis and of Edinburgh and Simon von Crevidel, hence the name Ellis von Crevidel disease. Moving to the clinical features, hands of these patients will be showing a post-axial polydactyly in the hands, that is, an extra finger lateral to the normal fifth finger is a consistent finding. Polydactyly in the feet is usually a rare finding though. Next to the bone dysplasia, characterized by acromesomelia, that is a relative shortening of the distal and the middle segments. It may interfere with the ability to make a tight fist as well. There will be presence of knock knees, and the nails of the fingers and the toes are dysplastic. There will also be presence of congenital heart defects that include hypoplasia of the aorta, atrial and ventricular septal defects, and a single atrium. There is also presence of dwarfism, that is the long bones being short and the trunk of the normal length. Hair will be fine and sparse. Moving to the oral manifestations, the teeth here will be deficient in number, and those which develop are small, rudimentary, conical spaced, and irregular in position. The teeth are affected with eruption occurring at the birth or shortly thereafter. The deciduous molars, if present, will be showing a crenate occlusal surface. The permanent dentition is more likely to be defective than that of the deciduous ones, and in here the eruption will be delayed. There will be presence of a partial cleft lip or a hair lip. The lip deformity, often referred to as a partial hair lip, results from an abnormality or abnormally short lip, which is also secondary to the hypoplasia of the maxilla, which is sunken during the development. Moving to the radiographic feature, as mentioned previously, these are having a short distal and a middle phalangeal segments. In relation to the proximal phalangeal segments, deciduous molar showing typical crenate tooth will give us the diagnosis of chondroectodermal dysplasia. Now, how do we diagnose this condition? Presence of polydactyly with a hair lip and a partial enodontia will favor the diagnosis of Ellis von Crevidel syndrome. How do we manage these conditions or these subjects? The only choice would be the surgical management of the hair lip, and it is done by surgical method for cosmetic reasons. The next disease the defect which we are going to deal is ectodermal dysplasia. It represents a group of inherited disease into which two or more ectodermally derived structure does not develop. It can be autosomally dominant, recessive, and X-linked. There are many types of ectodermal dysplasia, but they are very rare. The most commonly occurring is the hereditary hypohidrotic ectodermal dysplasia, showing the X-linked inheritance. Let us look into the clinical features, how they present. Males are affected more frequently than compared to the females. Appearance is characterized by hypotrichosis, hypohidrosis, and hydrosis with subtle nose appearance, with thin scalp hair, vision defects, cleft lip, inability to sweat, discolored nails, peeling of the skin, abnormally present teeth, and also there is presence of the partial hair lip. As I mentioned, hypotrichosis, hypohidrosis, and hydrosis with a saddle nose will be present, and the hair of the scalp will be, and also the eye tend to be fine and scanty and blonde. Supraorbital and frontal bossings are pronounced. They have one characteristic feature called as heat intolerance. Skin often in these subjects is dry, smooth, soft, scaly, with partial or a complete absence of the sweat glands. Such patient cannot perspire, and they usually suffer from hyperparaxia and inability to endure warm temperature. The next feature is a sibling similar appearance. Facial appearance of these individuals resemble to each other enough to be mistaken for siblings, but they are not. Moving to the oral manifestations, there will be presence of oligodontia or enodontia. The palate is high arched frequently with a cleft palate present. There will be conical conical shaped tooth present, and multiple missing teeth as well. The salivary gland, along with the accessory intraoral gland, are sometimes hyperplastic, resulting in xerostomia and dry cracked lips with a fissuring at the corners of the mouth. There will also be midfacial hypoplasia and leading to decreased vertical dimension. Moving to the radiographic features. The alveolar bone process does not develop in the absence of the teeth, and they appear thin and less vertical in dimension. And the teeth in the radiograph will be either absent or will be showing the conical appearance as clinically present. Moving to the diagnosis. Clinical diagnosis. There is absence of the teeth with the dry skin is a valuable aid in the diagnosis of ectodermal dysplasia. Radiological diagnosis includes the reduction in the height of the alveolar process, and also the special impression of the fingerprint is taken in the childhood to count the density of the sweat gland, providing the aid for ectodermal dysplasia. Now, how do we manage these subjects? Prosthetic replacement from the dental point of view, where partial or a complete denture should be considered for both functional and cosmetic purpose. The next is endogenous dental implant. It can be considered by selecting the proper site in the patient older than 5 years of age. The next developmental defect what we are going to deal is the Gardner syndrome. It's also called as familial multiple polyposis. It's a hereditary condition. The gene responsible for the syndrome is chromosome 5. Let us look into the clinical features. It is usually noticed in the second decade of a life with male predilection. It has got colonic polyposis. These are commonly found in the intestine, and this polyp has a high degree of transformation into adenocarcinoma. There will be presence of osteomas. That is, the osteomas are most common in the frontal bone, mandible, maxilla, and sphenoid bone. Osteoma in the mandible is present in the area of the mandibular angle and may produce a facial deformity in the long run. There will also be presence of limited mouth opening and other features like thyroid carcinoma and desmoid tumors. Let us look into the radiographic features. There will be presence of supernumerary teeth, unerupted teeth in the jaws, and osteomas present. Moving to the diagnosis. Presence of multiple teeth with the supernumerary teeth with osteomas in the jaw or other part of the body will favor the diagnosis of Gardner syndrome. How do we manage? Prophylactic colonectomy should be done as there was a high degree of a transformation into malignancy, and also removal of the osteomas of the jaw for cosmetic purposes. The next and the last we are dealing with is the Turner syndrome. It's also called as XO syndrome. It's a chromosomal condition that alters the development in the females. Turner syndrome is a chromosomal condition related only to the X chromosome in an individual. Let us look into the presenting clinical features. The females will be presenting with a short stature. Women in this condition will tend to be shorter than the average. They have often a normal height for the age of 3 years, but then they have a slow growth rate. At puberty, they do not have the usual growth spurt. There will be webbed neck, that is the extra skin present on the skin, and also puffiness or the swelling of the hands and the feet. There will also be low line present, shielded or a shield-shaped thorax, widely spaced nipples, shortened metacarpal with the fourth finger, small fingernails, brown spots, the zonivae, characteristic features like the folded skin, constrictions of the aorta, poor breast development, elbow deformity, and rudimentary ovaries with no menstruation in some females. Moving to the oral manifestation in these subjects. The patient will be noted with the high arched palate. Eruption of the teeth will be prematurely present with the corners of the mouth pulled down. Moving to the diagnosis. Webbed neck, broad chest, widely spaced nipple, short stature, only high arched palate with the corner of the mouth pulled down is a typical feature of your Turner syndrome. The management includes the growth hormone injection, beneficial in some individuals. Estrogen replacement therapy is usually started at the time of normal puberty. Summary in a small box of a memory of what we learned today. We learned first about the chondroectodermal dysplasia, also called as Ellis-Van Creveld disease, presence of post-axial polydactyly in the hands, bony dysplasias, knock knees, congenital heart defects. Then there will be presence of these rudimentary teeth, conical shaped spacing of the teeth, partial hair lip. As mentioned, polydactyly with the hair lip and a partial anodontia will favor the diagnosis of Ellis-Von Creveld syndrome. Management will be managing the hair lip with the surgical method of cosmetic reason. Next we dealt with is the ectodermal dysplasia, that is thin scalp hair which are blonde and sparse, vision defects, cleft lip, inability to sweat, that is heat intolerance, and presence of conical teeth and absence of multiple teeth is one of the diagnoses orally. Siblings will be appearing as if they are their family belong persons, but they are not. The next we are going to deal with is the Gardner syndrome. It's also called as familial multiple polyposis. Presence of colonic polyposis, osteomas, facial deformity, limited mouth opening, supernumerary teeth, osteomas of the jaw and other part of the body will give us the diagnosis of Gardner syndrome. Prophylactic colonectomy with removal of the jaw osteomas will prevent the further progression of the disease. The last what we learned is the Turner's syndrome, called as XO syndrome. Short stature, web neck, lymphedema, middle ear infections, widely spaced nipples, brown spots, high arched palate, premature eruption of the teeth, drooping or pulled down corner of the mouth will give us the diagnosis of Turner's syndrome. Thank you.